Good morning. This is News 4 Your Sunday.
Hello, I'm Lawson Muse. May is Mental Health Awareness Month. In 2014, NBC4 launched our Changing Minds project to help end the stigma surrounding mental illness and to tell our viewers about the many mental health resources available in our community. What started as a month-long project is now going into its 5th year. Today, we're going to be talking about two very different life experiences that can trigger mental illness, as well as a new mental health initiative in our area that is reaching out to millennials and their parents. Joining us to talk about this new campaign are Dr. Jacquelyn Duval-Harvey, who is a Prince George's County Deputy Health Officer, and Collette Harris is Executive Director of the National Alliance on Mental Health, also known as NAMI, for Prince George's County. Welcome, both of you.
Thank you.
The program, the campaign that we're talking about is called Step Forward. Tell us what Step Forward is all about, Dr. Harvey.
Step Forward is an attempt to make sure that people who have mental health challenges know that there are services available, that recovery is possible, and we want to end the stigma and the shame of having a mental illness. So we want everyone who wants to support an individual who does have an illness to step forward to say, I'm here to help, and services do work, and you can get help if you want it.
This is a new campaign for the health department.
Yes, it is.
So why did you decide to target millennials and their parents with this particular campaign?
We wanted to make sure that we had a way of reaching millennials that was comfortable for them. So we established a partnership with the National Text Line because we knew that they weren't using their telephones to make calls, that they were communicating primarily through text. And so we did a significant amount of research and found that that service was extremely effective in reaching young people, in responding to their needs, and when necessary, doing what's called an active response, because the phone itself can have you identify where that individual is located if something serious is going on, and we need to have people respond to the scene.
And you believe that they'll be more responsive
Absolutely.
Receiving a text
Absolutely.
than they would be more likely to pick up the telephone and make a phone call
Absolutely.
to say, I need help, or I know someone who does.
Yes, texting is part of their daily communication
Yes.
mechanism. And so it's also a little bit more distancing than having to actually speak and say to someone, I'm going through some changes, I'm having some negative feelings. So texting it, and the wonderful thing is, as soon as they text to 741-741, an immediate response comes. And so they can be connected to an individual who can talk with them through texting and give them the support that they need, whether it's a mild situation, whether it's a significant event, or something that requires immediate attention.
Ms. Harris, how is NAMI involved in the project? How did you get involved with Prince George's?
So we're a partner with the health department in raising mental health awareness in the county. We support their efforts, the anti-stigma campaign efforts. And so as a partner with the health department, we are in the community providing resources related to support groups, education sessions, we participate in community outreach events. We also have a helpline. So we're there as a support in the community at no cost to participants, and we've been in place since 1981.
You know, there have been so many campaigns. We mentioned that our campaign started 5 years ago, but in the past 5 years, there have been so many campaigns to raise awareness and to try to help eliminate the stigma. Yet, the sense is that there's still a lot of fear, a lot of denial.
Yes.
Would you say that's the case?
Yeah.
It's difficult to get people to accept, admit, and to seek help?
Well, people worry that something's wrong with their mind. And that's not as simple as saying, well, I can identify a pain and I know what it is, and I can go and get help and I know I'll be fine. It's a scary prospect. And so, you know, there's a lot of news around opioids and the negative effects and sort of the deaths that are occurring. So that is scary, and but not being able to make good decisions, which sometimes happen in a mental health crisis situation, people worry. And so their tendency to hide and to not be sure that they can actually get help is going to prevent a lot of people from accessing care.
And so that's one of the reasons you're doing you've started this campaign because, you know, despite the efforts, it's still a long journey.
Exactly. But part of the campaign also is to normalize the conversation around mental health. We all have mental health. We all have a need to have good mental health. And for those who do not, who are struggling, we need to let the community know that we're here to help, that there is a possibility for recovery if you are struggling with a mental illness, and that there are resources here in the community to help you and your family in helping you get through those challenging times.
All right, we're talking about the Step Forward campaign, and when we come back, acknowledging how two very different life experiences can actually trigger mental illness. Stay with us. We continue our discussion on mental health, and Ms. Harris, can you tell us how family members can identify mental illness in a loved one? What are some of the symptoms?
Certainly. Oftentimes it's a change in personality. There's excessive worry, unusual anger, irritability, a sense of helplessness, a sense of hopelessness, and just a disconnect from what was considered normal behavior for the individual.
And if it continues?
And if it continues, typically over 2 weeks, after 2 weeks. If it's occurred for 2 weeks or more, then there's reason for concern, and the person, the family should seek professional help.
Dr. Harvey, what are some of the other resources available to residents in Prince George's County?
Yeah. So we have a series of shelter ads that are going to be all over the county, and they will contain information about where individuals can get help if they're looking for a provider. We have a website. It's pgchealthzone.org, where any resources they need in terms of in any part of their community, we can identify where there's a provider who can help them. We also have a phone number if people want to call and get information and ask questions, and that's 301-856-9500.
All right, and the campaign is Step Forward.
Step
and
Forward.
You're reaching out to the millennials, their parents, and everybody else
Exactly.
who may be suffering with these issues. Thank you so much for joining us, Dr. Jacquelyn Duval-Harvey and Collette Harris.
Thank you. Thank you.
And when we come back, acknowledging how those two different life experiences can trigger problems in you or someone you love. As we continue our talk about mental illness, joining us now is Johan Orjuela. He is a bilingual therapist with the organization known as EveryMind. He also works at Gaithersburg High School. Welcome to this segment. Mental health professionals are now sort of shifting their thinking away from asking people, what's wrong with you, to what happened to you? Why that shift, and why is it effective and working better for children and teenagers?
Asking the question, what happened to you, removes us from the stigma of trauma or disclosing that you experienced trauma. And it is an open-ended question that invites, in a safer way, the individual to talk about what happened to them, instead of asking what's wrong, which can be accusatory, and it also implies that there's something not normal about them.
So you get more information and you're likely to break through the ice a little more easily.
Yes, it's also more inviting.
Yes.
It also removes us from assuming
anything.
Anything, yes.
Do most of us recognize trauma? Do we know if we've been traumatized or if someone we love has been?
It's not easy to recognize, because people don't talk about it, but to be aware of what trauma looks like can help, and to know what some of the symptoms could be
and what
help.
It is.
Yes.
You're working with young people at Gaithersburg High School as a therapist. What are you seeing among your students?
I'm seeing a lot of students experiencing depression, anxiety, some with a history of complex trauma, which is trauma that has happened to them over and over again. Some also displaying some symptoms of PTSD. Definitely a lot of students experiencing the pressure from parents or peers.
What are some of the symptoms, quickly?
Inability to sleep, inability to focus. And that is also very important because a lot of kids who are not able to focus think, oh, maybe that's ADHD, but in reality, it could be something traumatic. They might be thinking about the trauma or what happened to them over and over again. Sometimes it affects their eating patterns. It also affects how they relate to others, so they may become isolated. Weight issues can present.
All of these are things that a parent would want to be on the lookout for.
Yes, yes.
And be aware of. Can children be virtually traumatized online by bullies?
Yes, definitely. Social media, it's out there and it's a reality nowadays. I think it is intensifying a lot of these symptoms of depression and anxiety on kids. But bullying has been there for a long time. Now with social media, it's a little different, but it is intensifying the whole dynamic for kids.
And so is bullying a traumatic event? Does it produce trauma?
Yes, definitely. Definitely. It can come from being called names, being physically abused by other kids, and sexually harassed.
And are there studies that show the impact of trauma on bullies and their behavior? Is it likely that if they're bullying, they've been bullied?
Yes, and also that was part of my focus in one of my classes when I was in graduate school. I remember doing a little bit of research about this, and yes, a lot of the kids who have experienced domestic violence at home can take these behaviors to school or other settings and either become a bully or easily be targeted.
So we want to make sure that anyone watching, any young people or any parent or others who know that this may be happening, also know where to go for help. And where would they go? Should they go to the school resource, to the school officer, the therapist on campus?
A lot of the times going to the school officer can make a big difference. The security, if they are in a high school, can help reporting by an adult.
Do you have a website at EveryMind?
Yes, it's everymind.org.
Everymind.org. Yes. And there's lots of information there.
Yes.
And lots of pointers to resources that can help.
Yeah.
Johan Orjuela, thank you so much for joining us.
Thank you.
And up next, the pressures of being a successful professional, performer, or C-suite executive, and how those pressures can impact your mental health. Washington area is filled with high achievers, people who are no strangers to power, money, and all manner of success. But how can the stress of success impact your mental health? Dr. Colleen Hawthorne is a concierge psychiatric medical doctor. She's a life coach, speaker, and author as well. Welcome, Dr. Hawthorne. Many people think that successful people have it all, and in reality, we know that is not always the case.
That's right. Thank
Correct?
you. Thank you, Pat. It's good to be here with you. Not at all. You know, we can be so blinded by the glamour and glory that's often associated with highly successful people that we can miss the fact that they're human. And, you know, they have real life stories just like everyone else.
So what are some of the ways that success can actually impact you, your mental health?
Yeah, Pat, many people do not realize the magnitude of the weight and the pressure of, I call it spotlight overexposure. You know, always being in the spotlight and always having to be on. There's a lot of heat in the spotlight. And this can really drive a lot of stress and even burnout if you're really not mindful about how you're managing your high-profile, high-success life.
I've often heard of people who are really high-functioning who suffer from mental illness. Can mental health issues actually drive someone to be successful without their even realizing it?
Actually, Pat, yes. I think of the case of bipolar disorder, and that is a very common mental medical condition. It affects 2.5% of the adult U.S. general population. And so we know some of our most successful and most highly achieved people actually have underlying psychiatric conditions or have had mental health challenges. In the case of bipolar disorder, you know, when you're in a manic phase or hypomanic phase, that means, you know, not as extreme. You have boundless energy. The creativity is much more heightened. Energy level, you know, is tremendous. And you can even not need much sleep. So you can be extremely, very highly productive in that stage of the condition.
And what if they do realize there's an issue? Can that drive a person to pursue success as a way of compensating for the mental health problem?
Again, actually, yes. You know, we know that people with great challenges really know how to dig in deep. They learn to dig in deep to overcome their challenges and adversities. And as a result of that, can really develop a fighting spirit, an overcomer spirit. And often that makes for, you know, tremendous workers and people that are very empathic and very committed to helping other people to succeed because of the extra that they went through to overcome to still be successful.
And there's all that going on beneath the surface.
All that going on beneath the surface.
Well, we know that destigmatizing mental illness is important for all of us, but how much tougher is it for someone who's high profile to publicly come out and say, hey, I've got a problem, and it's been diagnosed, like Mariah Carey, for example?
That's right, Pat. Unfortunately, it's much more difficult because of their high positions and often high visibility as a high profile, highly successful person. That heightens those concerns about fear of stigma, the fear of being criticized or judged or misunderstood, the fear of being exposed if that gets exposed in the public before you're ready to let people know, if you choose to do so, which is someone's prerogative, whatever their medical condition is. And I say medical because mental illness conditions are medical conditions. So it's up to a person to choose if they want to bring that up, not necessarily just have it exposed. And so there's that extra fear with people that are highly successful because they're always in the public.
Yeah, and does it help the rest of us if someone who is as public as a Mariah Carey says, hey, I've gone to a doctor, I've gotten a diagnosis, and I'm being treated?
Absolutely, it does. And I so commend Mariah Carey for doing that, to heighten the awareness. You know, Pat, mental health conditions are so common. In fact, 1 in every 5 people, adults in the U.S. general population in any given year, is dealing with a mental illness. That's a huge number, you know, and people that are highly successful, high profile, are not exempt from that. The statistics do not change. They're not exempt. Mental health conditions can affect anyone, the rich and the poor, the young and the old, the very educated or less educated.
And
absolutely.
Are the symptoms the same?
Yes, the symptoms of various mental health conditions are the same. However, the context and the setting in which those symptoms may manifest or be seen are different. So for example, for people that are, you know, entertainers, let's say, you know, they're on the stage, they're, you know, very visible in the public eye. And so that may come out in how they're singing or performing, and you don't know that some of the, you know, exaggeration or some other behaviors may actually be part of what they're dealing with, that there may be some imbalance going on with their condition at that time.
What about a politician?
Oh, absolutely. Again, some of our most successful people are high-profile achievers, and I will say, yes, high government officials, absolutely.
What is the one piece of advice that you'd give to someone who is watching right now who may be struggling with mental illness or who may know someone, may love someone who they believe is struggling?
Pat, that would be to reach out for help. Mental health challenges are so common. That's for all of us and every one of us. Reach out for help. Do not allow the stigma, the fear of stigma, to to keep you from getting the help you need. Don't settle for less than that vibrant life that you're created to live. Mental conditions are very treatable, so get the help that you need. Seek that help.
There's treatment available. All right, Dr. Colleen Hawthorne, fascinating conversation.
Yes.
And insight. Thank you so much. And
most
to
welcome.
see any News for Your Sunday program, you can go to our website and search Community. I'm Pat Lawson Muse. Thanks for watching today, and we'll see you next time.